Good morning. My name is Tony Sanchez, and I'm the Director of the Office of Recovery Transformation here at the Department of Behavioral Health and Developmental Disabilities. I'm also a person in long-term recovery. So I want to welcome you to Mental Health Awareness Month, an important event that I want to take the time to let you know a little bit about. The Office of Recovery Transformation works on the behalf of individuals living with behavioral health challenges. We are here to make sure that individuals with lived experience have a seat at the table and that the voices of the people that we serve inform our services, our supports, and our policies. We partner with peer community leaders such as the Georgia Mental Health Consumer Network, the Georgia Council on Substance Abuse, and the Georgia Parent Support Network, peer-run organizations, providers and community service boards, and many others across the state of Georgia to deliver quality services, but also to employ people living with mental health conditions because we believe that they are valuable contributors to the work that we do. We continuously work to develop innovative ways to pull our recovery oriented system of care forward and to make sure that the people we serve are leading their own care. Here at the Department of Behavioral Health and Developmental Disabilities, we support recovery because we believe that mental health matters. We believe that people in recovery are valuable contributors to the work that we do. And most importantly, we believe that recovery is not only possible, but that recovery should be and is the expectation. We believe that recovery is not only possible, but we believe that recovery should be the expectation. That is so true because one of the hindrances or one of the reasons, the biggest reasons why that people don't get the help that they need is because of stigma. We need to create platforms where people can talk about what's going on with them. And that is very true in my life. There was a time when I didn't live in within my mental health. I lived more in my mental illness, and what that caused was incarceration. It disconnected me from my family. It didn't allow me to connect to my purpose, and at times I wasn't even living. I was just surviving. Mental health has given me the opportunity to first and foremost get to know who I am, which then allows me to find my purpose and assume my position within my family, within my community, and within my state. Today, because of my mental health, because of my recovery, I'm a husband, I'm a father, I'm a grandfather, I'm gainfully employed as the director of the Office of Recovery Transformation. I'm a member of my church. I'm a member of my family. I'm a brother. I'm a son. I'm a taxpayer. I'm a homeowner. I get to live a life that I did not think possible. That's why mental health is so important, because if I can recover, so can anyone else.
Kelly Sterling, I'm Director for the Office of Deaf Services at the Georgia Department of Behavioral Health and Developmental Disabilities.
The Office of Deaf Services is committed to supporting mental health awareness in Georgia. We recognize the impact that mental illness has upon deaf individuals in their lives, with their families, and in their communities and in their employment. We are mission-bound to break down access barriers so that the deaf community can receive the support they need in the critical times in which they need help in their language of preference. The ways in which our office does this is through our communication assessment. The assessment identifies the language of preference for individuals who are deaf and then identifies the accommodations needed for accessing services. Our office also provides training and consultation to our provider network so that they can better meet the needs of the deaf community in a culturally competent manner. The Office of Deaf Services has contracted to have ASL fluent professionals around the state of Georgia so that individuals who are deaf can have access to a signing clinician and meet with the clinicians in the communities where the deaf individuals live. The Office of Deaf Services also provides interpreters who have received mental health training so that the deaf individuals who are accessing DBHDD services can have greater confidence in the skills of the interpreters for their mental health needs. We want to break down the stigma of mental illness. ODS's goal is to be here alongside the deaf community in Georgia to promote access to mental health services and see the deaf community thrive.